everyone. Michelle here from ASIS Massage Education on our Mesa campus. So happy to have you join us live today. And those of you watching the recording later, thanks for checking us out and joining this conversation. I'm really excited to introduce our guest today. Some of you may know that ASIS has a sister school called ACOLS, the Academy of Lymphatic Studies. I have done a couple of live streams on our lymph sisters over there on the East Coast of Sebastian, Florida. And I just wanted to get more information in front of our viewers about the Academy and what it's all about, and what better way to do that except with our founder. So Joe Zuther has agreed to join us live today and take part of this conversation and talk a little bit about the Academy. So let's bring him on and say hello. Hello, Joe.
Hello. I'm not a sister, but I'm a brother, so I hope.
Yes. I know. We should just call it a sibling school. Make it all inclusive in there.
Hello, Michelle.
Hello. Thank you so much for joining. I know we talked a little bit earlier, and I was looking forward to getting into some of the topics that we wanted to cover. And I'm like, well, we got to save this for the show, because it's some good conversation that we are going to have. So I really appreciate you coming on and doing that. So first, can you please tell us a little bit about your journey into the lymphedema world and how you kind of got involved in this field?
Oh boy. Okay. Well, let's start at the beginning.
Okay.
I graduated massage school. I grew up in Germany. Graduated massage school in '81, and decided to continue to go to PT school. Graduated PT school in '84, and then worked as a PT in a city with the name of Ulm in Germany. That's in South Germany on the Bavarian border. And so how did I become interested in lymphedema therapy? Well, I guess like many of you guys, like how did you become interested? I'm sure you heard about or you saw massage clients and patients that had swollen extremities. And the same happened to me. I came across patients that they came for whatever, shoulder, knees, hips, or whatever, backs, but they had swollen extremities, arms and legs, and I had no idea what that was back then. That was in the 80s, in the mid 80s. The situation was similar than it was here a couple, decades ago. Nobody really knew what it was, even though lymphedema therapy was practiced in one way or the other in Germany since the 1970s, but it was not a well-known field. So I did a little research and found out, well, that's not a regular swelling like a venous insufficiency or congestive heart failure or whatever. This is something else. So I found out it's lymphedema. And did a little research. That was before the internet, so it was a little bit more involved in it maybe today.
And thank you for doing that, by the way. It helped us out this way.
I found out that there is therapy available, and there was a professor with the name of Feldy, Professor Michael Feldy, who is my father, my professor father. And I decided to attend one of his courses. He had a lymphedema clinic in the Black Forest in Germany, and he offered classes. So I decided to go to one of those classes, which was in 1985, like a couple months after I completed PT school, and I came across those patients. And it took 4 weeks, and I became a certified lymphedema therapist and went back to work. And like many of my colleagues, I got hooked. I loved lymphedema therapy because it's such a tangible treatment. If you treat a shoulder, a shoulder or a knee or whatever, you have to X-ray vision on and say, okay, this is what's going on. We have to do this. But lymphedema is completely different. You see it. It's a big arm or a big leg, or maybe not so big or really big, like with lymphocytic elephantiasis. And if you do lymphedema therapy, you see the results, often immediately, especially during the first week of treatment. You see sometimes drastic results, and I just got hooked on it. So hooked on it that I didn't do much else. I just treated patients with swollen necks. I became known as the lymph guy, in the city. And I decided to become an instructor, which was not easy. There were just a handful of instructors. It was very difficult. You needed to go to Professor Foldy. You needed to be on his good side. So he would allow you to learn under him. So thank God my relationship with him was good. And I took that instructor course. I forgot how long it took, but it took quite some time, like maybe a year or so. I did my internship at the Foldy Clinic, got really introduced to very interesting and very involved cases of lymphedema, not only lymphedema, but also, there are other, like lymphedema usually develops due to surgical procedures involving the lymphatic system, but there are other causes that cause lymphedema, the swelling, such as lipedema, like big lower extremities that can develop into a condition called lymphedema. There's also venous insufficiencies that can develop. A venous insufficiency in the early stages is more like an edema, like a low protein swelling or a normal swelling. But if venous insufficiencies are not treated properly, meaning with elevation, compression, and taking care of the underlying issue, venous insufficiencies can also develop into lymphedema, which is then called a phlebolymphostatic edema. So I did a lot of lymphedema work. And back then, parallel to my work as a lymphedema physical therapist, I also taught anatomy and physiology at the university there. The PT school is associated with the university. So I was already teaching like for a year or so anatomy and physiology. And I inquired with the higher ups, the leadership in the university, if they would be interested in starting a lymphedema program, and it took some convincing on my side, and they agreed. And this is how the Department of Lymphology developed. So I started the Department of Lymphology at the Ulm College, the University of Ulm, and that was the second school for lymphedema therapy in Europe. The first school was the Foldy School. The second school was the Ulm College. And that's what I did for many, many years. And in the early, I was married, or I'm still married to an American. She lived in Germany, but she wanted to go back to the United States. So I had to. Well, to make a long story short, I had no choice in the matter. So we moved to Florida because her parents live in Florida. So we moved to Fort Lauderdale, and I started to work as a PT. Started basically from scratch, and was surprised that lymphedema was a completely unknown field in the US back then, like the early 90s. In fact, when I worked as a PT, I talked to doctors in the hospital. I worked in a big hospital, General Hospital in Miami. Nobody knew about lymphedema, and when I talked about lymphedema, and those even specialists, oncologists, vascular surgeons, lymphedema, that's a European problem. That doesn't exist in the United States. And if those people have big arms and big legs, they just need to learn how to live with it. There's nothing that can be done. So it was really a very difficult situation for me, because I knew, what can be done, what should be done, and I could not believe that research was pretty much not acknowledged here. So pretty much the wheel had to be reinvented. So again, long story short. In '93, I started a lymphedema clinic in Fort Lauderdale. And I decided to translate the German curriculum, the curriculum I developed in Germany for the Ulm College for that lymphedema program, to translate into English. And I advertised, and lo and behold, a couple of people were interested. I think the first class, wait a second, there's a plaque here. How many people did we have? 1, 2, 3, 8 people. So 8 people attended the first class in '94, early '94.
Okay.
And from there it went. I named it the Academy of Lymphatic Studies. It's, lymphedema schools were non-existent in the States. So there was another guy here, Gunter Close. He also treated lymphedema patients in cooperation with Dr. Lerner in New York. But the Academy of Lymphatic Studies was the first proper lymphedema school. And from there, it just developed, from there you go. So this is my
Yeah. Oh,
short
that's amazing. Oh, no, I love it. I could keep listening to that forever. So it was primarily for lymphedema, and to help treat patients who had lymphedema. And as I know, in taking your MLD course, is still it was misdiagnosed a lot. Maybe even now, people misdiagnosing what lymphedema is to be maybe a overweight condition or just something else going on.
Absolutely.
But do you think that that's really made a lot of leaps and bounds in the 20, 30 years since
Oh
you
yeah.
did that? Yeah.
You know, thank God for the internet. I mean, people, like I said, people still, you know, to this date, even in Germany, I go back there on a regular basis, and I teach and do classes, you know, for med students. They have a lymphedema program there, which is the
Mhm.
first program in the world. I teach second year med students there. It's just like 10 hours, but 10 hours is a lot,
Mhm.
considering that in the United States, if you go to med school, you don't hear nothing about lymphedema. You make here and there a couple sentences, and that's it.
Right.
So, but even to this date in Germany, some doctors state, you know, I mean, it's like with us, you know, PTs, MTs. If you are not interested to go for continued education, you just don't know. So
Right.
the same with physicians. You know, if they're not interested and just doing their thing, they just don't know about lymphedema. So even
Mhm.
in Europe, in Germany, where this therapy was born, and like you know, there are still to this day patients here. Well, there's nothing we can do. However,
Mhm.
the situation drastically improved. The internet, there's so many websites with the start of the internet that were dedicated to the education of lymphedema patients. So patients had another resource now. You know, they
Mhm.
were, okay, nobody can help me, and you know, some patients got interested and they learned, and obviously we did a lot of things. You know, with the academy, we were instrumental in creating CPT codes, like, you know, codes that you use for reimbursement.
Mhm.
Like I went to Washington, to Congress, and talked to representatives and convinced them. Was a lot of things going on, and to tell you, like, to finish answering your question, yes, the situation
Mhm.
has improved. I mean,
Mhm.
there are no other schools in the United States that teach lymphedema management. Not only the Academy of Lymphatics, there are other very good schools. It's not just
Mhm.
the Academy of Lymphatic Studies. And also a lot of doctors became interested in the field.
Mhm.
There are more developments now in terms of non-conservative treatment, like, you know, complete decongestive therapy is a non-surgical
Mhm.
treatment. There are now surgical techniques that are used to treat lymphedema, such as, you know, VLNT, like vascularized lymph node transfer surgeries, or lymphovenous
Okay.
anastomosis surgeries, and others that are really helpful. However, there's a broad consensus in the medical field that lymphedema surgery should never be done as a standalone therapy. Complete
Mhm.
decongestive therapy is always the primary treatment.
Yeah.
Also, you know, there are pumps now, there are lymphatic pumps, so-called
Mhm.
intermittent pneumatic compression pumps that can function as a supplemental or adjunct therapy for lymphedema. However, also with the pumps, there's a very broad consensus in the medical field that those pumps should never be used as a standalone therapy for lymphedema,
Mhm.
but only as an adjunct to lymphedema therapy.
Right.
Also,
Right.
if a patient, like, let's say a patient comes for lymphedema therapy. Let's say the patient has a really big extremity, and the lymphedema therapist was able to bring it down to a normal or manageable size. But
Mhm.
there, let's say, you know, if the lymphedema therapist removes the fluid component of the lymphedema, there may be still some excess fibrotic tissue or fatty tissue present in the extremity, which can be
Mhm.
very difficult to be removed with compression therapy, which is part of complete decongestive therapy or manual lymph drainage. And some of those patients may decide, for cosmetic reasons, or let's say if let's say the leg or the arm is very big, that, you know, causes shoulder or hip restrictions, or the gait doesn't function, or the daily activities are really, you know, messed up because of the excess fatty and fibrotic tissue being present in a treated lymphedema. They may decide to go for surgery and have
Mm-hmm.
It's called a liposuction. It's scary because liposuction is usually known, for cosmetic surgery. However,
Right.
the liposuction, a treatment used for lymphedema therapy, is completely different from
Okay.
liposuction, and only physicians that are very knowledgeable in lymphedema and those new procedures should be consulted to do lymphedema surgery. But again, I'm still answering your question, and I wanted to make it short. Yes, the situation has improved.
Yeah.
There's a lot of information out there patients can access. Many physicians now know about lymphedema.
Mm-hmm.
Physicians get involved in lymphedema, they become specialists, they become lymphologists, So the situation is much better, but there's always room for improvement.
Exactly. Yeah. And
Because
even
lymphedema is super, super common. You want to know how
yes.
many people with lymphedema live?
How many?
Well, about 140 to 250 million people worldwide. That's
Wow.
a huge number.
That
In the
is.
United States, it's about 3 million Americans.
Wow.
So it's a common problem. So it's not something that you just that can be neglected, like whatever, migraine or something. It's even migraine. I shouldn't say migraine because migraine has a much higher incidence. But you know what I'm referring to. So
Right.
it's
Yeah.
a very common issue
Very
that
prevalent.
yeah.
Yeah. Absolutely. And so you're talking in the CDT, or the complete decongestive therapy, having a multifaceted prong approach, basically. So we have the manual lymph drainage, so the actual techniques that therapists are moving the fluid through, right? And then we have compression, bandaging perhaps, and maybe using some of the pumps and some other things. So having a full team, of course, or someone trained in all of those is very important. And we said earlier, I don't know if it was our pre-talk and the interview, that sometimes lymphedema can be caused by some surgeries. There's a side effect of it. So another reason why it's important to have that complete multi-prong approach for even the surgeries that people are having for lymphedema, right? Because couldn't it also exacerbate the problem if they don't do the aftercare?
Absolutely. If a patient, like every surgeon that treats lymphedema will tell you, it needs a multi-professional approach. You need the surgical team and you need a lymphedema therapist. Like a good lymphedema surgeon, and I know a couple, they employ lymphedema therapists. Even though, even if you go for liposuction or VLNT or like those lymphovenous anastomosis surgeries, lymphedema can always reoccur. Lymphedema is a condition that currently there is no cure, so you need to manage it lifelong. So even if a patient goes for surgery, the vast majority, like over 90% of those patients, they still need compression therapy. They still need to wear the compression stockings or sleeves. If they don't, lymphedema will reoccur because the damage to the lymphatic system is present. It's there. It cannot be reversed. If lymph nodes were removed or radiated, or if the lymphatic system didn't develop properly, that's an issue that doesn't go away. It's always there. So you always have to take care of it one way or the other, even after surgery.
Yeah.
Yeah.
Yeah. So it's definitely a shutdown of the
Michelle,
mechanical system behind. My screen just went a little funky. I think the internet is
sorry,
getting a little funny.
you're breaking up. It's not.
Are we
It's
still? Am I still there?
on my side. So, yeah. Sorry. Well, now I can't hear you.
Back up.
So we have an issue.
Internet here, just in case. Oh. Uh-oh. Let me see if I can hold the phone, folks. Those watching live, just
now it's better.
Let me get this going.
It works again.
It's better?
Yeah.
Okay. Yeah. I don't know what I did or didn't do, but I'm gonna, just in case, get my my side Wi-Fi here ready, and just in case I need it, I might have to switch over to that. But I was gonna say, with the mechanical deficiency in lymphedema, that affects a lot of people, but there also is that dynamic effect, insufficiency that happens, and that can be in the form of edema that happens, correct, in the body. It's a different process.
Of what? Sorry.
Oh, edema.
Yeah. There are two. I mean, there's edema, there's lymphedema, two different things.
Right.
Like
Yes.
edema can be remedied by elevation or compression alone, whereas lymphedema does not react well to just elevation and compression. You need to manually move the stagnated lymph fluid around the blocked area and move it to an area with healthy lymph vessels and lymph nodes.
Yeah. Yes. But there's still a lot of people who experience edema throughout their day. And is there a reason? I guess that where I'm trying to go with this is there I go again. Let me switch over to my other internet here real quick because I know this is
Yeah, you're breaking up periodically.
Again. So, okay, I'm over onto the other system now.
Okay.
Hopefully that works. Hopefully that works. Okay, let's see. Cross my fingers. So sorry for the interruption.
No. Oh my God! At least you know how to take care of those things.
Yeah,
I told
hopefully.
you before,
Yeah.
like I'm on any scale, I'm a 0 on technical issues. So
you got to be prepared. Anything can happen, folks. Live. So where I was going with my question is, so you developed ACOLS, the Academy of Lymphatic Studies, to work with CDT or lymphatic lymphedema patients to treat. But I know one of the very popular courses that we have at ACOLS is the MLD, or the Manual Lymph Drainage Certification class. So how did that come about? And could you explain some of the differences in it, and like who really, I know I was going to talk to Marina about this, to our education director, but where was that born from, and how did that get developed?
Well, especially for massage therapists and PTs that work post-surgically, or PTs or massage therapists or therapists, healthcare professionals that work with surgeons. Like, you have post-operative swellings, like if you have surgery for a knee, for example, knee replacement, hip replacement, you name it. There's always edema involved post-surgically, and edema is always bad. Edema means you have a lot of fluid in the tissue. A lot of fluid in the tissue means there will be a deficiency of cells when it comes to oxygen and nutrition. So edema is always bad. Like it's like a swamp, like the tissue looks like a swamp. And if a tissue is healthy, it looks like a happy little stream in the mountains, but that is not the case if you have lymphedema. So if you have lymphedema, edema in that case, same thing. Lymphedema even worse, but even also with if you have swelling post-surgery, it's a very important to eliminate or decrease the swelling as soon as possible after surgery and as effective as possible. The sooner you remove swelling post-surgically, the better the healing. And that's basically it. And I know in the past there were therapists that wanted to take the class, but they said, well, I don't want to treat lymphedema. I just want to treat those patients that have swelling, like post-surgical swellings, post-traumatic swellings, like if I have a sprain or something, your ankle swells up and so on and so forth. So that's how we developed the MLT class, to take care of those things. Like the MLT class is not a simplified version. It's just a completely different approach.
Right.
Like if you have post-surgical swellings that are not lymphedema, the lymphatic system is usually sufficient. It's healthy. The lymph nodes in the axilla are there and healthy. The lymph nodes in the groin, the inguinal lymph nodes are healthy. So if this is the case, there is no need to reroute lymph fluid as you would do if you have a lymphedematous swelling where the lymph nodes were removed due to breast cancer surgery or genital urinary cancers or prostate cancers, and the inguinal lymph nodes are removed. So if you have just a swelling, which is also bad, you can involve the lymph nodes and the lymph vessels as they are, anatomically. So the approach is not as involved as it is with lymphedema, but also very effective if you do manual lymph drainage. and you follow up with compression therapy in case of edema,
Mhm.
and maybe exercises if necessary, and skincare if that is something that is necessary with scars or wounds. I lost my train of thought, but what was the question?
Just how the MLD class came around
Okay,
and who it's designed for.
I came back. So if you do MLD, you stimulate the lymph vessels, like the collectors, like the larger
Right.
lymph vessels, and they have smooth musculature within their walls. And if you stretch those lymph collectors with that technique, which is named Manual Lymph Drainage, not a massage, it's a completely different thing, as you know. You stretch those lymph collectors, and if you stretch those lymph collectors, you stretch the smooth musculature within the walls of those lymph collectors, and that increases the activity, the lymph angio
Motoricity.
Yes, exactly, of the lymphatic system. And of course, you will improve lymphatic drainage. And if you improve lymphatic drainage in those post-surgical or post-traumatic swelling, you improve or decrease the time the swelling is present. And the shorter that time is, the better the nutrition and oxygenation of the tissues that were damaged. So it's a win-win.
Yeah. Oh, it's amazing. I was telling you a little bit in our live chat about how I kind of pushed it aside, lymph work aside my whole career. I've been a therapist 20 years, and I took this class, and I was just like, where has this been my whole life? It's amazing. And anytime I get on the table, like because I have one of the other instructors is needs a body sometimes to demo, and I'm like, sign me up. I'm like immediately asleep. And I can't believe how relaxing this technique and this work is. And even just little things like my head feels swollen, I can try to do a little bit of neck work on myself, and I feel it immediately open up. And then it's so amazing. So many different ways to use it in our practice.
Just to give you another example, it's not big here at all, but pretty big in Europe. Migraine headaches. Migraine headaches react very well to manual lymph drainage. Migraine headaches are called, if you have real migraine, it's like a pain that is, I don't have it, so I just know it from textbooks and patients. It's a pulse synchronous pain, like with every heartbeat, it like pulsates, that pain. And that pain in migraine is caused by swellings within the walls of intracranial arteries, because the brain itself does not have any nociceptors, any pain receptors. So the pain associated with migraine headaches, which must be horrible if you have migraine, that pain is associated with swellings, perivascular swellings in the intracranial arteries. So if you improve the lymphatic drainage in the neck lymph nodes, like there are tons of lymph nodes on the neck, you improve lymph flow from not only from the head and face, but also from intracranial areas. And of course, if you increase or if you stimulate lymph flow, the swelling in those walls of the arteries that causes the migraine headache decreases, and thereby the pain associated with migraine headache decreases. It's very big in Europe, and I wish it would take a foothold here, but so far, no. But just as a tip for you and everybody who listens, MLD on the neck for migraine headaches works.
Yeah, I know. I just from my own, I had a sinus headache, and just doing a little bit, opening up those lateral cervical triangle area and, getting the terminus open. It felt like almost a suction effect that came, which is one of the side effects of what it's supposed to be doing. So I'm
see,
like,
now I come back to the beginning. You get hooked on it because, you see often immediate result. Not immediate, not the next second, but, within the treatment or within a few treatments, you see sometimes dramatic results.
Yeah, it's really, really powerful work. And I remembered another question I was going to ask about the lymphedema and the massage therapist. So I know a lot of people who take the MLD course are massage therapists. And I've been in like 5 classes now, and all of them, probably 90% are massage therapists. And some of them ask, should I take the CDT class, the complete decongestive therapy class with lymphedema? And I said, well, are you going to be working with lymphedema patients that much? Because in our scope, most of the time, massage therapy, we're not bandaging. We can't bill for massage for, some of the CPT codes because we're in our scope. We can't do it. But have you seen people, maybe an MLD massage therapist, work with PTs and perhaps do the manual part and then send the patients over to the physical therapist or somewhere else to do the compression bandaging or anything like that? Do you see
Absolutely,
that?
absolutely.
Okay.
I see it. Many MTs work with clinics or PTs, but I also know that many massage therapists accept don't bill insurance companies. So, if it's a private pay situation, I mean, you can still do, a compression therapy and decongestive exercises, to improve lymph flow and apply a moisturizer to the skin, because lymphedema, the skin is very dry and scaly and tends to develop infection. So besides manual lymph drainage, which is definitely within the scope of a massage therapist, the application of short stretch bandages and skincare and exercises can certainly be done. You just can't bill for it.
Yeah.
It's a private pay situation, unfortunately.
Right. Yeah.
OTs, PTs, of course, they bill for it.
Right. Yeah.
Yeah.
Well, sometimes insurance not always the best thing anyway. You have to wait
Yeah,
for
but
it.
I also know from experience in Florida, MTs get they get reimbursed.
Oh.
Not for compression therapy, but for many other things. So billing.
Interesting. Yeah, I know all the states are different, and there's a lot of research. Sometimes just the research alone makes me tired to even think
Oh my
about
God,
how to do it. So just give me cash. That works better. Absolutely. So these days, what are you doing for the academy? Are you teaching anymore, or what are some of your things that you do?
No, I don't teach anymore. We have such good instructors. Marina is with us since 94, or 95, 94, 95.
Yeah.
So she's our primary instructor. No, there's no need for me anymore. Marina just, she's the best, and all the other instructors she trained or I trained. There's Marina I trained, and a lot of other instructors I trained there still, Trudy Ferguson and others. Not only in America, we also do classes. In other countries like Saudi Arabia, we have a Academy of Lymphatic Studies, Saudi Arabia, and other countries. And those instructors I trained when I was still teaching, but all the instructors nowadays, they're all trained by Marina, and she does an excellent job. So what I do nowadays, I do a lot of research, stay current with upcoming methods, do really a lot of research, work with people involved in the field. Legislative work, when it comes to the accreditation of the CLT initial, which is often a little tiresome and tricky. As you may have heard recently, like LANA changed their eligibility requirements. So LANA is the Nephrology Association of North America. But everything is still good, and I have books out, and of course those books need updating. New editions are forthcoming, so I'm busy. I'm very busy. Yeah, I'm very busy.
You make wonderful visual aids. Yes, so I love that. I love every time we have these in the classes. Everyone's like, "Oh, they're so great to look at." So I keep that inspired in here for that. So what do you think about everything? Do you think we will continue to see this growth in people looking for manual lymph drainage and CDT? I just know, I feel like more and more in the past year, maybe it's just because it's one of those things in my brain that I'm thinking about it, so it appears more, but I feel like there's more conversation about post-surgical work and people understanding lymphedema better. Do you see this exploding even more with more people getting this kind of treatment?
No doubt.
Yeah.
No doubt.
Yeah.
No doubt. Just look at secondary lymphedema. There's primary lymphedema, there's secondary lymphedema. So secondary lymphedema is the most common form of lymphedema in the United States. And it's usually, due to, let's say, breast cancer surgery. Breast cancer is very prevalent in the United States. Like, I'm sure you know those numbers, 1 in 8 women in the United States develops breast cancer during the course of their lives. And 50%, almost 50% of those women that went through breast cancer surgery will develop some degree of secondary lymphedema within 20 years post-surgically. To put that in perspective, I just said 1 in 8 women will develop breast cancer. The latest 2021 statistics from the CDC and the American Cancer Society tell us that annually 270,000 women are diagnosed with breast cancer. 270,000. 2,700 males. So breast cancer is not only a female problem; it's also a male problem. It's one man for every 1,000 women. Yeah, exactly. 270,700, and 50% of those individuals will develop some form of secondary lymphedema. You do the math.
Yeah.
There's only, like, compared to the huge number of just secondary lymphedema patients, compare that to the number of certified lymphedema therapists. It's a handful, not even a handful.
Wow.
So there's a huge need for lymphedema therapists, and it will only increase because of the legislative work we are all doing. Lymphedema is now the gold standard, or lymphedema is complete decongestive therapy is the gold standard primary treatment approach for lymphedema. It's not something I say, it's something the American Cancer Society says. You can go on their website, you will find that complete decongestive therapy is the gold standard. The National Lymphedema Network lists it at the gold standard. The Lymphology Association, the ISL, the International Society of Lymphology. So it's the gold standard. It won't change, even if surgery. Maybe one day there will be the magic pill that takes care of lymphedema. In that case, I'm happy to get out of business. That's great.
It's good for the world. Yeah,
that would be wonderful. But as of today, there is no cure. There is only complete decongestive therapy and supplemental therapies like intermittent pneumatic compression or pumps or laser, like low-level laser therapy and others. Again, to come back to your answer, the need is huge.
Yeah.
Huge.
It's
never ending. Again, 270,000 cases of breast cancer in females alone.
Yeah.
Every person that is diagnosed with breast cancer will go for cancer surgery, meaning removal or radiation of the breast tissue, lumpectomies, mastectomies, and the removal of the lymph nodes in the axillary, because there are cancer cells in the axillary lymph nodes, so they need to be removed or irradiated.
Yeah.
And 50% of those individuals will get lymphedema. So just do the math. There will never be enough lymphedema therapists.
Yeah.
Never. And with new developments like the Lymphedema Treatment Act, that is currently again to pass Senate, hopefully the House, hopefully soon, there will be reimbursement for compression therapy for lymphedema patients. So things are good. Future is good. Future is bright for patients with lymphedema.
I'm excited. I'm excited to be a part of it. Yes, that's so exciting. I just speak at ACOLS praises and this work, just all over, just amazing. And so I don't want to say simple, but in a way it is. And it's just from our perspective and what we teach the MLD and that part with the physical work of the MLD drainage. It's gorgeous. I love it. Love it so much.
I'm glad to hear that.
Yeah. So I know I want to be respectful of your time because I know you have other commitments. So I wanted to get to our hot seat fun questions at the end, if you don't mind.
Oh, wait, yeah, good.
Yeah, okay. All right.
I forgot about those.
I know, now sprung them on you. Okay, so which talent or superpower would you most like to have?
Flying.
Flying. Do you like the act of flying or just being able to get somewhere else?
Well, I guess everybody had that dream, that you run and you flap your arms and you take off. Never left me. I'm a pilot and I skydive. So, but this is, you need something to get up there. And man, if I would have superpowers, I put on my cape and oh my God, yeah. So that would be it.
All right. I like it. If you weren't in the field that you're in right now, what would you be doing? What is another career choice?
Yeah. Well, two. I always wanted to be a doctor. Unfortunately, our family was not blessed with monetary riches, not at all. We were 10 children. My father died early, so we were poor. And university for medical school was just not in the stars.
Mm.
So I would love, still to this day, I would love to become an MD and obviously a lymphologist. I would want to be a lymphologist or a sculptor / painter. My grandfather on my mother's side was a famous, maybe not, but a very well-known painter during his lifetime. And that's in my blood. I paint a lot, I sculpt a lot, and if I could do that full time, heck yeah, I would do that.
Awesome. Oh, I love that. I'd love to see some of your work sometime. That'll be fun. Yeah, we should feature it in the slideshows for your classes, in the ACOLS classes. If money or
In the slideshows,
yes, that's what we'll put them in the back. That'd be beautiful. Yes. So, next question: if money and circumstances were not issues, where would you most like to live in the world?
Well, that's easy. I was blessed. With my work with the lymphatic studies, I traveled all over the world. Except the Arctic and the Antarctic, I was on every continent and was blessed to see the most wonderful places. The courses with the academy, like the certification courses, were not always 9 days. They were like at the beginning, they were much longer. We had 4 weeks, but I told you before already. In Germany, lymphedema therapy is still taught in 4 weeks, like 135 hours, 60-minute hours in 4 weeks. It's just not doable in this country, paid time off and things like that. So it's much condensed, and throughout the years, we found the perfect equilibrium between paid time off and whatnot. So we are now at 9 days. However, when I flew all over the country, all over the world, I stood in those countries at a minimum of 3 weeks teaching, and we had the weekends off, and I was lucky enough to explore those countries. And if I could live anywhere, it would be either Japan or South Korea, because I like Asians, period. And those countries remind me very much of my home country. I was born in Bavaria, so I'm a mountain guy. So if I couldn't live in Bavaria, I would want to live in Japan or in South Korea.
Oh, look at
Because
that.
they're wonderful and so clean.
Yeah, I lived in Japan for 3 years. So,
where did you live?
I lived outside of Tokyo in Saitama Prefecture.
Oh,
so, yeah. Look at us making connections.
Look at this.
What is your most treasured possession?
Oh, pictures for my grandfather, like paintings.
Oh, I love that.
Paintings.
Oh, that was an easy one.
That was an easy one, yeah.
And then what would you tell your 18-year-old self?
Yeah. Gosh. I would tell my 18-year-old self to just, it needs a little bit of explanation. I told you before, I always wanted to become a doctor. Even when I was a kid, I want to be a doctor. And it was just not, I thought it was not possible because, I needed to make money. And, contrary to the situation in the United States, in Europe, if you go to massage or PT school, it's free. You don't pay for it. It's government sponsored. So that's all I could afford. And of course, I had to work nights, in the disco. I was a bartender and a waiter in the disco to make money, to pay my rent and everything, and to be able to support myself. So med school was not in the stars. However, when I think back now, I think if I would have told myself, well, just do it, there's always a way, that's what I would do. I would just go for it and do whatever is necessary and not try to shortcut. I hate shortcuts. If you always need to be you have to be to go from A to C. But yeah, it is what it is. So I would tell my 18-year-old self, just do what you want to do and just do it.
Yeah, make it happen. Well, I have to say that Plan B worked out pretty nicely because I am grateful for it because of this work, and I have to thank you for that. So thank you for finding your journey the way it was, because it led me to this work too. So really appreciate that.
Very kind.
Yes. So I know you're short on time, so I wanted to thank you so much for today, and I really had a pleasure speaking with you and getting to know you a little bit and getting to know the man behind all the posters in the book. And I hope you have a good rest of your weekend, and hopefully we'll talk again soon another time.
Thank you so much, Michelle. Thank you for your kind words, and thanks for having me.
Oh, thanks.